as a matter of fact, I had planned for this year itself for Poland, but unfortunately, because of these COVID situation, my
COVID.
whole trip for Poland, I was planning to be there for a month in Poland because I'm planning to set up something in out there. So, but now I'll have to move it on to 2021 now. Hi,
Right,
Arash.
right.
Hi,
No.
Goenka here.
Hi, Sunil. Hi, Arash.
Hi.
Sorry, I missed the earlier programs, but I thought to the health management. I have two things. Of course, when you were talking about that she is very intolerant to cold, same thing with
Yes.
me because of hypothyroid, number one. Number two, in fact, I want to talk to you on this issue that how to control BP naturally. I
Okay.
don't like to take. Lately, it so happens that suddenly my BP is shooting to 150, 100. Morning, especially only in the morning hours. When I'm getting up, I find heavy head and things like that. But at night, when I'm taking my BP, it's 110, 70, or even lower than that.
Okay. But when we had spoken
So,
last, after that, what I had suggested to a few things is still not helping you. The homeopathy and all, you stopped those pills in the night, which I told you to continue it in the morning time. So you're getting a sleep.
I do take two Rolfia serpentina in the morning and at night.
Yes.
And I prefer to take certain homeopathic pills, what you had suggested also, ginkgo and all those things. But somehow, suddenly I find that after a few days, again it's shooting up, again it gets normalized, again. Possibly my wife says you continue with the BP pill for a little while. I do pranayam, I do 40 minutes or 30 minutes of cycling, station cycling, etc.
Wow.
I'm able to do it. But today morning when I got up, it's a very terrible day, whole day.
Okay. Now,
So
see, once you are on your BP medication, then you need to carry it on further because it is like your system kind of stabilizes and kind of gets used to that medication, first of all. In the first case, what I usually suggest is try to go the natural way, not to go with the medication unless it is really, really required. Now, in your case, you've already on the BP medication, so just to cut yourself out from the BP medication would not be the right thing. So you need to, has to be a very gradual and a very slow process for you. So that is
okay,
how you would have to just go slowly with it now. And on a higher side, then, or if you have the higher BP, then you have to be more than careful on that side because then it can really take a toll because higher BP will affect do you have your occasional headaches and do you have your dizzy spell and all that stuff?
one sec. I don't know, chip kar aao na zara. Chester, quiet, beta. Sorry, I missed your question.
No, when you are, what's your kind of a symptom when you talk of the high BP? When you talk of the high BP, then people have headaches, then they usually tend to, have the dizzy spells and all that. So do you have, what kind of a thing do you have? The fatigueness do you get?
A sort of heavy-headed in the morning to some extent, and sometimes like I'm swaying off. Like how I did take working few days as if it's
Okay.
didn't turn out to be that very problematic.
Okay.
I do pranayam. Then sometimes I start feeling, like, oh, maybe pranayam, which I'm doing very slowly and properly, that is hurting me. I'm trying to analyze what is hurting me really. But I do not want to get into this having tablets for BP because everybody tells that it's very, very harmful in the long run. I have
Naturally.
family of diabetes and high blood pressure, heart disease. I want to keep myself fit,
That
and
is true.
maybe.
So no, I will tell you exactly what needs to be done with the regards to that. First of all, see, the exercise is very important, and what you're doing is if you had not been exercising the way you are exercising, you would see your BP level really fluctuate, and it would really affect you completely. So fortunately, your exercise is helping you keep your blood pressure in control. Okay. Secondly, is your diet also. So we need to look into your diet habits as to how you're eating, when you're eating, and what you're eating. So that also makes a big
Okay.
impact on what it is. And the third and most important is your sleep pattern. So your sleeping pattern has to be taken into consideration also. So these three things, out of which the first one you've already taken care of. The second one, which I'm sure the diet factor also, I'm sure is also to a certain extent you are in control with it. And the sleeping pattern also, we need to understand how and what time you're sleeping, and what are your daily course of action during the day. So that's when we need to understand that. But that we can do that on one-on-one basis. So then I can
Sure.
exactly help you out what is what. Because
Okay.
when we talk about
That
this on a BP, this thing, it'll be very specific to you itself, and might not be, uh, it'll not be right to
oh,
speak on a generic level to you,
very
because it
much.
has to
Yeah.
be very specific to you. So that
Sure.
is how I would
I'll
I
get
would say.
okay. Yeah,
Exactly.
I'll get in touch with
So the whole idea for today is I'm going to be talking about injuries, injury management today, and I'm going to we all talk about sports. Just a minute, huh? Let me now get back to this. So when we talk about injury management, what do I mean by injury management? Okay, when we talk about that, in one thing one has to understand it. In any given sport, we injury is going to happen. We are going to be prone to injuries. Yeah, some sports we are at a higher rate of risk of injuries, and some would be on a lesser rate of risk, right? So all in all in one, one cannot say that any one particular sport is injury free. I would say that any sport, even the most uh, passive sport also, like I would say, like say table tennis or even a golf. When we talk about golf, is like a a sport for the people who are like on the lazy Sunday. They want to go along, have a few swings at the ball. But then those also have injuries also. When I talk about a simple game of table tennis, you would say what you're doing is just playing with a simple small racket and a ball. But yes, but then there are a lot of movements to the table tennis racket also, at the sense that you can have injury to your wrist, you can have injury to your ankle also while you're moving around the small perimeter of the table also. And when we talk about golf, when we are doing the swing, you can have a pull to your back, your knee. So these are some simple passive sports also, right? Where you can have injuries. So we cannot really rule out that any particular sport you're not going to have any injury. So that is something which is very wrong. So what people are really propagating around there is that if you do this in a way that you are going to have injury. No, we need to do it in the right technique. That is the whole idea. If you do anything in the right technique, in the right form, you are not going to have injury. Yes, if you will have injury, but then at the end of the day, the the extent of injury would not be as extensive as doing it in a wrong form or in the wrong way. Now, if I would talk about, say, for me, the most prone sport, right, where you are prone to injuries is football. I am talking of not of the American football. I'm talking of the simple game of soccer. This game is a very active sport where the rate of injury in comparison to the other sports is very, very high. Now, when we talk about bodybuilding, and I'm talking about bodybuilding in the terms of like, lifting up weights. A lot of people are advocating, you should not do this particular exercise, you should not do this particular exercise because it'll lead to this injury or it'll lead to that injury. If you're going to be avoiding those, then at the end of the day, don't do any weightlifting. You should not be doing that. So you have to make sure that you are there, you are guiding the people that, okay, if you want to lift a certain weight, make sure that the person is lifting the weight the right way, in the right form, the right way the technique has been done. So at the end of the day, if he's doing that the right technique, the injury is going to be very, very less, right? So this is where we have to understand
you.
that
Right.
very clearly. Now, in this, let me give an example. Like we have Arash also, who does his mixed martial arts. So on that also, if they don't take precautions, right, they are going to be every one single bout, they're going to come with a broken nose, They can have brain hemorrhage also if they are not protective. If a single blow to their head, they can lead to a brain hemorrhage also. So they have to be protective also. So we need to understand. So bodybuilding for me is a very passive sport. Okay, compared to football where we are always on the move, we are being pushed by players, we are being always running, we are being nudged by the other players and all that stuff. And in bodybuilding we don't have that say. It's us and the weight, and that is what it is. So in this case what we have to do is we have to push ourselves. We have to take that extra mile of lifting the extra weight. So that's when I say the difference between an active sport and a passive sport. So a passive sport is something where we need to push ourselves in order to excel, in order to move ahead. But in an active sport, we are being pushed, right? Now, when we talk about the injuries, the most common injuries that we usually tend to have are ankle sprains, because when we are standing, the whole pressure, when we walk along or something or the other, the ankle is the first one that takes the pressure, right? Then we have the groin pulls, then we have the hamstring strains, then we have the shin splints. The knee injuries also, there could be like two types. One is basically you could have a ligament tear, or you could have your kneecap, which has been, due to a lot of overuse and or wrong use of your knee in the wrong form, has led to its, your kneecap has rubbed off over a period of time. And another thing which is very common is tennis elbow. But many a times what happens is tennis elbow is something where people have taken it as completely wrong. If you have some pain around here in your elbow, that doesn't mean it is tennis elbow. Tennis elbow basically originates from here at this point. You understand? From here. So this is why? So when you're kind of clenching something, you will not be able to clench it. So here is a particular muscle which kind of goes all the way to your fingers, and that's where you should be able to hold it, and you will not be able to hold. And that is why when we talk about tennis racket, when you're holding a tennis racket or anything as such, you're always having that thing. So this particular muscle is always being strained out here. Nothing to do with this tennis. Nothing to do with the elbow. But it is connected. All it is connected around here. So it is, you feel the pain around here itself. So we usually tend to construe it as a tennis elbow. Yes? So that's something we need to understand. Exactly. Could you please mute your...
Maybe. Now,
yes.
I do get pains, but a lot of cramping. Supposing I'm trying to, put a handle down. There'll be a cramp here, and my finger would turn like this, or I do
Yes.
get a lot of cramps over here. That be relating to the tennis elbow coming across?
No, those cramps are completely different. Tennis elbow is where the pain is really going to be excruciating. You will not be able to even lift your pen also. It's going to be so bad.
No.
So cramping is basically to do with the nerve.
Okay.
So that is something. See, this is where where we need to really understand, and we need to manage our injuries, and this is where we need to figure out what is actually wrong with us. Many a time we go to the doctors will say A, but it is not actually A. They'll make you do X-rays, they'll make you do all that stuff and all that, which is not really required in the first place. So the whole idea for this session is for us to understand, right, from our point of view right now, what exactly has happened to us. Once we can understand, what has happened to us, we will be able to help others also. So suppose if you are out and you see somebody who has had a fall or who's had some kind of an injury, just by ascertaining the injury or the fall, you will be able to know how bad it is, whether the person has had a sprain, or whether the person has had a strain, or whether it's a broken, he's broken the bone, or it's a hairline fracture, or it is just a simple twist. You understand? These are small things where we need to understand that. So if we can understand this, so we'll be able to not only help ourselves, but we'll be able to help others also in the long run. So when I mentioned about this sprains and strains, yeah. So that is one thing where again there is a lot of misconception and misconstruction as to what is sprain and strain. Many times people think it is the same, but no, it is not. When we talk about sprains, are simple injuries to the ligaments. Okay. Now, what are ligaments? The ligaments are the tough bands connecting the bones in a joint. Now, ligaments are a soft tissue, but they are the second to the bone. We have the bone, then we have the ligaments. So the ligaments are as good as your bones because they are very strong. Okay. So suddenly stretching of these ligaments past the limits deforms or tears them. So you can they tend to snap off. So when they tend to snap off or they will break kind of a thing, like of the bone, they are like a formation or they have they're not the bones, but they are as tough and strong as the bones, ligaments. Then we have the strains, right? The first we are talking about the sprain. Now we are talking about the strain. Now the strain is basically the injury to the muscle fiber or the tendon, which anchors the muscles to the bones. So you have the bone, you have the ligament. How are they connected is with a small kind of a muscle fiber or a tendon, which connects it to them. Very simply put, like this.
Sorry to interfere. Is meniscus tear something to do with sprain or sprain?
Meniscus tear is completely, it's not, no. It's a complete tear itself, but it would be on a sprain side because it's a tear completely. It's not a strain.
Oh.
Now, let me just finish with the strain part itself. When I say the strain is basically what has happened, this particular tendon, right, has been pulled. That's why they call it a pulled muscle. So what happens, your ligament is there, your bone is there. So they are all attached together with this tendon, right? So this is being stretched. So stretched, or it's called a pulled muscle, right? So when this is called the overstretching or overusing of the muscle causes the tear in the muscle fiber or tendon. So once this snaps off, this happens when people are on heavy steroids. This particular muscle tendon and this ligament, okay, they tend to snap off when you are on heavy steroids. So this is where this point is, which is very critical. So this, when it happens, then we have to make sure it comes back to its normal self. So you can always have the muscle build up over it.
Yeah.
Okay. So now let's think of the ligaments and the muscle tendon units like a springs. Like if you remember, I had mentioned they are like elastics. Yeah. The tissue lengthens with stress. Okay. And it returns to its normal self unless it is pulled beyond its normal range. If you recall in one of my sessions, I had mentioned about how these trainers, I would call them really unprofessional trainers who make their clients overdo with their stretching. This is where they are actually overdoing with the stretching, and they can have that tendon tear off over a period of time. So you have to be very careful with this. Yes? So now how to prevent these injuries, but nevertheless, it is not done right, you would harm it. But still you could, before every workout, start with a gentle warm up, right? To prevent common sport injuries. When I say you need to do some warm ups and all that stuff is basically to have the blood flow moving in. Getting warmed up increases the blood flow to the muscle, gets you more flexible, and it could, at the end, reduce your injuries. I always recommend is a brisk walk, for around 10 minutes, or you can do your elliptical also for 10 minutes before you start any kind of your weight training or any kind of physical training that you want to do. Also, then we are talking about is the way of recovering. Once we have an injury, we have what we term is called as a price system. Now, what exactly is price? The P here stands for protect from further injury, right? When you have an injury, when you at the gym, right, you've kind of pulled your back muscle or you've got a strain somewhere, you need to just stop everything at that point of time. If you pulled a neck muscle or you've kind of, when you were kind of doing and you did a nudge to your back, right, you need to just stop there. You need to ascertain exactly how bad it is by not stretching it or by hanging it or by doing some other exercises that might just help you relieve it. But at the bargain, you might just worsen that situation. So first thing is just protect it from further injury is just by doing nothing to it. Just let it go, let it cool down. Remember one thing, when you are in the gym, yeah, your body is already flowing, your blood is already flowing, it's already warmed up. So at that point of time, even a small injury, yeah, at that point of time, because you might feel it's a small injury because your blood is already warmed up, your body is all warmed up, you will not feel that injury so much. But when your body cools down, that's when you feel how bad the injury is. So whenever you have any kind of injury at that point of time, you need to just kind of relax it out. I have seen trainers, oh, you pulled your back muscle. Okay, go now. You do this kind of stretches. He will make him do this stretches. He'll make him hang, or he'll make him do this twisting or that twisting. Don't do it. You don't know what exactly has happened at that point of time. Maybe it's a small thing. It's just a small muscle swelling itself that has happened at that point of time, or just small strain, like I mentioned earlier. But then if you are doing it something wrong, it can really have further bad, consequences to it. So just let it be at that point of time. Let your body cool down. Then you will ascertain exactly how bad the pain is. Then only you will be able to ascertain how bad the injury is. Coming to the next part is the R. R is basically restricting the activity. Okay. And when we talk about restricting the activity is basically when if you had a shoulder injury, so make sure don't do any kind of shoulder movements around it. Just make sure if you have a sling around or something, or just hold your arm to your chest or your stomach, just don't, and lock it up. Don't move it. Just restrict the movement out there, right? Let it cool down for you to understand what exactly it is. Many a times the muscles, when they are strained, right? When they are strained, the muscles usually are, when they are pumped up, they come blow up like a balloon, right? And in that bargain, they tend to touch some other tendon around, right? When you let it cool down, you will find that sometimes the pain is also gone. So we need to not overdo that. We need to just let it relax. The body has given you the signal that you need to stop there. Don't go along overdoing it, because it can lead to a lifetime injury if you just go along doing it. Third one is the I. Is basically, when I say I, is applying ice immediately, after a common sports injury. Now, ice is basically, it's a miracle drug that they say, immediately if you have an access to ice, or if you have any access to cold water also around there, use that and apply it, because it's an anti-inflammatory without any side effects, believe me. Use ice for 20 minutes every 1 to 2 hours for the first 48 hours after the injury. Don't use heat at that point of time. It encourages swelling and inflammation, and we don't want that to happen. So ice, right away, use it.
1 minute,
yes.
I have a question.
Yes.
Normally, we always confuse whether to use ice or hot pack, because what happens is that it's a bone injury. Use
Yes.
Hot pack.
I'm coming to that.
It's very difficult to judge in time. You would be the right person. You would be understanding to know,
Yes.
but for us, it's very difficult to understand.
I'm coming to that.
So
I'm coming to that. Basically, when to use your hot and when to use your cold fermentation. That's what I'll be coming to that also. So now coming to the next aspect of the price is the C. C is basically compression with an elastic bandage that will help to reduce swelling. So once we have taken care of these other first parameters of your prevention, your restriction, and applying ice at that point of time, and if you have a kind of something where you kind of wrap it up around, if you have an injury to your hand or your wrist or something, you can just wrap up something around at that point of time, so you don't give any further movement to it, so you don't have any damage more. So just kind of hold it to there, or band or something that can hold it at that point in time. So it kind of limits the movement till the time you actually go see a doctor, get an x-ray done, or just to ascertain how bad it is. And then the last is basically is the E. E is basically is what we say is elevate your injured area. And when I say elevating it, is basically is elevating it above the heart level. Now, when you have any injury above the heart, this is perfect, not a problem. Also on your hand, try to hold it up. If you have a thing with your shoulder, that doesn't mean that you need to be, moving along with it. Or with your leg, you need to lift it above the heart. No, don't do that. But the whole idea is if you have the possibility where you can, have that injured part in a way that you have, just take it above that level where you don't have to, strain it further, right? Where the blood does not flow more. When you talk, why you say about the heart, above the heart level, because of the blood is always pumping more blood out there. So when you are pumping in more blood, you will feel the gush of blood coming in there. And when the gush of blood is there, then there will be more and more pain you will feel at that point of time. So that's when we tend to say is like, try to elevate the injured area. Now, coming to your question is, when do we administer, hot or cold, fermentation to the injuries? Yeah. So it's very simple, hot and cold fermentation. So many a time people have mistaken this. When they're supposed to use cold, they put hot. And when they're supposed to use hot, they use cold. And then instead of having a relief, it kind of, it aggravates the situation furthermore. Yeah. So we need to be very careful as to when and what has to be done. Now let's first understand what are the benefits of when we're doing heat compressions or heat fermentations. First is when we are doing the heat fermentation, it improves compliance of soft tissues. It relieves pain and spasms. Yeah, heat is most useful in warming up stiff or scarred soft, the soft tissues which we have, before stretching or exercise. That's when it helps. Many a times, a lot of people tend to apply balm. If they have a certain soreness around this thing, they apply balm around their, their shoulders. If their shoulders are very prone to injuries, they tend to apply some balm around it, which kind of heats up the whole area, and then they start to get to the exercising itself. So heat may also be useful for relieving pain or spasm associated with neck or back injuries. So it's very good for your neck or your back. You need to understand that also. Heat, when we talk about heat therapy, yeah, it is basically, we are talking of vasodilation. Now, what do you mean by vasodilation? Is basically drawing blood into that target tissues. Increased blood flow delivers needed oxygen and nutrients and removes cell waste. So what we are doing when we are giving in heat, putting in more oxygen there, giving it more kind of attention that it requires at that point of time than it is getting. Yeah, the warmth decreases the muscle spasm. So whenever you have the muscle spasm, the warmthness helps you to relax the tense muscles, it relieves the pain, and can also, it increases the range of motion around you. Ice, on the other hand, yeah, it also decreases pain. It also decreases, but it also helps, like I had mentioned, it's an anti-inflammatory, or works well for inflammation. So if you have any kind of a swelling right away, ice is the best thing that you should be using. Yeah, it works good for cramping, but then again, we need to understand what kind of a cramp it is. And best time for ice basically is after your workout, post-workout. Cold therapy is, like I said, heat therapy is vasodilation. Cold therapy is vasoconstriction. Sorry for my pronunciation because it's all medical terms. Yeah. So basically, what we talk about the vasodilation is basically we are adding oxygen to the more blood and oxygen to that the tissue which is being affected. Whereas in the cold therapy, we are kind of reducing it. We are slowing down the circulation. We are cutting down the blood flow. So that is what we are doing, is we are limiting it. So that is when we do that, we are cutting down, and when we cut down the blood flow out there, so that inflammation gets reduced. Your muscle spasms and your pain will also reduce. Another thing where we talk about is a combination. Okay, we talk about the contrasting therapy, which is a combination of hot and cold. I especially recommended it for the nerves as it stimulates the blood flow within the nerve. Hot and cold work similarly to the heart pumping. You understand? So the heart pumping is basically like, it's like, compression and the expansion, compression, expansion, compression, expansion, thereby helping the circulation within that point of discomfort. So we need to understand whether it's really a spasm or a muscle, or what if it's a swelling where you need to use, or at the same time whether it's a nerve. So we need to understand when and how to use these kind of things at that point of time. So now many would ask as to how to identify the injury, like Sunil asked here. So what needs to be used? So as a general rule of thumb, simply use ice for acute injuries or pain, along with inflammation and swelling, right? Use heat for muscle pain and stiffness. So if you have a muscle pain or you feel like a stiffness around your neck or in your back, there's certain stiffness around there. So that's when you go for heat. Okay, it is very effective. Heat is very effective to relieve sciatica nerve pain. Don't use cold for that. Sciatica nerve pain, that's right at the bottom of around the tailbone and your hip bone. That's when it connects it. So that's where the pain is very common. A lot of people are facing that who are into physical activity. So that's where you need to have heat therapy. So basically, to conclude, both ice and heat have the potential to do some minor temporary harm when used poorly. You understand? So we need to be very careful at it. Heat can make inflammation significantly worse. So if you have inflammation and you're putting heat on that, you are actually aggravating the situation. Whereas an ice can aggravate symptoms where you have the tightness and stiffness. So if you have a stiffness in your neck, in your muscle, and you're going to put some ice pack, you're going to be more stiff. So that's why you need to have the heat pack for that. So we need to, as an individual, we need to understand whether it's really a muscle stiffness that we have, that we need to use a heat pack, or when it's a swelling that needs, where we need to bring it down, where we need to use the ice for.
But injury to the bone?
Injury to the bone, also you need to use ice, because whenever you have an injury to the bone, it right away it leads to an injury. It leads to a swelling. Whether you have an hairline fracture or whether you have a broken bone itself, any form, it will lead to a swelling.
Okay.
In any given form. So if heat is not the one which you should be using for that, you need to use cold first to get the swelling down. So if you have, one need to understand if the first thing, many people, when you have a fall, you need to understand how the fall has been, one. Secondly, after the fall, if that particular area, if you had a fall on your wrist, right? If that particular area has swelled up completely right immediately, okay, the whole area around is swelled up, and even anywhere you touch it, it pains. Even a small touch, it pains. So that is a sign that there is really, it's not a muscle, but it's a bone that has caused it. So first, you right away put ice packs around it. Try to get the inflammation down. Have anti-inflammatory pills. Turmeric is the best thing for the natural form if you have at that point of time before you go to the doctor.
Oh.
You can get an x-ray done. So this is something where you need to do it. So first sign you will see when you have a hairline fracture or you have a fracture completely, that particular area is going to swell up right away. And whenever you touch anywhere around it, it's very sensitive.
Okay. So that's why you can differentiate between your structure injury or the muscular injury.
Yes, exactly.
That's okay. Now, many times while doing an exercise, I'm doing a stationary cycling, and then in the knee, I can feel some cracking sound or something, and it pains for a while. Then again, you use heat or cold because there's no damage as such to the bone. It's just
for the heat, that sound basically is a sound that it's the rubbing of your kneecap itself. Not the kneecap is basically your tendon have kind of rubbed against each other. Yeah. So it's that's why
Yeah.
if that pain goes away after that, there's a sound, cracking sound, and then the pain goes away, right? It's a momentary pain, and there is no swelling or anything else that don't worry about. But if you do have a swelling, right, then you need to use cold.
Got it.
Because in your knees area, especially, what happens if there is any kind of swelling, it right away there's a water formation around the knee. So if you're going to use hot, you are actually encouraging it further. So for the knee, you usually tend to use cold. Now coming to the next aspect is we talk about hot shower and cold shower, yeah. So what are the advantages of hot shower? When should we use? People always say hot shower is much better, or cold shower. What is what is it? When I talk to a lot of people, they say that their body craves in the morning for a hot shower. The majority of people crank the handle all the way up in order to feel the warm water all over their body. I can imagine that. But did you know that a cold shower also have a place in your daily routine? You need to have that. You need to have that. The ones you dread to take, yeah, when you're the last person to get up in the morning, you don't want to have a cold shower. It's just that you want to be under a warm shower. You need to do that once in occasionally. You need to have cold shower also in between. It's not only for your body alarm system, but it also works on your autoimmune system also. Regardless of how you feel about either type of the shower, research shows that both hot and cold showers have health benefits. Yeah. Now I'm just going to talk about some of the benefits with regards to the cold showers. Now, cold showers itchy skin. Always. If you have an itchy skin, just get for a cold shower. And I'm not talking a lukewarm or anything. I'm talking of a cold shower. Second, it just wakes you up. Remember one thing, if you are kind of going for a meeting and you're this is like a coffee booster, you don't need to have a coffee or anything or a Red Bull or anything. You just get under a cold shower and it'll wake you up. But it has to be really a nice cold shower to wake you up. Then it also helps in increasing your circulation, your blood circulation, because it works like a shocking system to your body when you get under a cold shower. And that's when your system goes a little bit haywire, and just to control and regulate things, that there's a lot of blood flow which is happening. So that's when it increases circulation. My favorite is basically it reduces your muscle soreness post workout. So whenever if I have had a very strenuous workout or anything as such, I always like to take a cold shower. A lot of tennis players have known to take freezing cold showers post their training, post their matches, because then they have to be ready for the next match also the next day. So if they go under a hot shower, then the muscle they'll have really aches and pains the next day. So then in order to avoid that soreness and all that stuff, they go for really freezing cold showers. So that really helps.
Normally,
yes.
Like after workouts, I prefer to have, you've done a lot of cardio and all that. I prefer to have a cold shower. But nowadays, Mumbai, with this, we don't really have cold shower. It's not that the temperature is really cold, but it's just a normal room temperature water.
Yeah, that's okay. That's okay. But no need to really make it hot or lukewarm also as such right now at that point of time. So let your body handle it. And also then with the increased circulation, that, like I mentioned earlier, it says that, just to be on a happy, it make you a little bit happy. It helps to boost your weight loss also. So that is how they talk about it. And on the beauty side, it also helps, glowing it gives you a nice glowy hair and skin. So one thing we need to understand, when that cold spray hits your body, yeah, there's a bit of a shock. Now this shock increases your oxygen intake. Like I said, there's an increased circulation. When there's an increased circulation, there's more oxygen intake into your body. Your heart rate also increases, and your alertness also, because of that, is increased. So you need to be, this is also why I really look at a thing where cold showers has far more effectiveness. compared to a warm or really a hot shower. Okay, now you will say this is okay. These are all the good sides, but does it have any? What is the flip side of it? Well, the flip side that is that cold showers might not be a good idea if you are already cold. Yeah, if you are living in a cold area, like Saroj is living in Geneva, where it is already cold. So in cooler temperatures, it's not going to help warm you up by any means. Yeah, it could actually even make you even colder and increase the time for your body to warm you up. So you need to know how to work and how to balance your body out. You need to work the systems, how to work way, how to and when to use those showers. Yeah, this may not be a good idea if you're sick. Yeah, if you have a cold temperature, right, might be too hard on your immune system. So it's best to ease it at the cooler temperatures. So if you're having a cold or if you're running with the flu or something, don't do it at that point of time. Your body is already busy fighting that viral. So let it just do that. Just don't overburden it. Now, coming to the aspect of the hot showers. Now, if you have trouble relaxing or falling asleep at night, you might be tempted to take a hot shower to ease the stress, yeah, of the day. That is but common. People want to just at that point of time just take a nice hot shower because it's really like I told you, like when you take the hot fermentation, it helps to relax the muscle, the stiffness, you know, it helps you to cool down. So this is a very common practice for muscle relaxation before going to sleep because hot showers activate the parasympathetic nervous system, which makes us tired. That is what it is said. Yeah. Other benefits is that it provides relief from respiratory symptoms, sorry. Helps with blemishes, muscle relaxation, like I mentioned earlier. So these are the kind of things where we need to understand when we need to take the hot shower. So it's just a way of relaxing us and you want to get a good night's sleep. No problem. Just take your hot shower, hit the hot shower and then just get into the bed and then you'll see you'll have a good night's sleep. Again, the flip side of hot showers, okay, they tend to dry out and irritate your skin. Hot water
Yes.
causes damage to the keratin cells, yeah, which are located on most of your outer layer of the skin. We have the keratin cells around there. So then it gets, with the hot, they kind of dehydrate and they kind of irritate us. So this is the outer layer is basically the epidermis. So when we are disrupting these cells, it creates dry skin and prevents the cells from locking in moisture. So then that's when you will have that kind of irritation, around your skin. They can also make your skin, there are certain skin conditions when you have, yeah, it will make it worse. Higher temperatures make it easier for the skin to dry out and worsen conditions like eczema. So you need to understand that also. So if you have a certain kind of a skin rash like eczema or something, we need to just avoid hot showers. We need to take cold showers at that point of time, not to aggravate it. Hot showers can
Right.
also cause you to itch. Heat causes mast cells, yeah, to release the contents in the skin and cause itching. That is what it is said. Did you know that it increases your blood pressure? Coming to your
Hot
point, coming to your point of Sunil, with your blood pressure, if you have problems, like in your case, you have with high blood pressure or cardio, even a person with a cardiovascular disease, yeah, taking a shower that's too hot can make these conditions worse. So if you're taking
Okay.
a hot shower in the night time, right, it's
Take a
advisable not to.
Okay. Normally, many times what I do is after taking a very hot shower, put on the cold shower and then enjoy it for a while.
Yes,
Or
yes.
take a
So
very
this is Yes.
uh,
So this is the other approach also where people are doing that. Uh, I will give you that example when I was in Poland, right? When I was in Poland, we were in a temperature like minus 10 degrees. So a friend of mine, local friend out there, he said what they do is that in the shower time, for for a moment, for like in total amount of like 3-4 minutes, yeah, of the total shower time that they have, of 15-20 minutes, say around 3-4 minutes of uh, in breaks, yeah, one minute, they switch from hot to cold. So this is
Okay.
basically called contrast showering. Okay, but
Like,
this contrast shower is a very age-old technique. In this, you basically get the water as cold as possible and stand in front of it for 1 minute. Simple.
chill shower,
Right?
when I take a very hot sauna steam in the club, and many times I do that, and after taking a very hot steam or a sauna, I prefer a very cold, chilled shower for a while, and then it's really like, you get really a shock sort of thing, and then you really
Yes,
feel good after.
yes, yes. So this has to be both at the same time. So you are hitting your body with hot, and at the same time, then at that moment, you just turn the tap over, you get into cold, really cold. So when the minute is up, you then change the water to as hot as you can handle for an additional minute. Alternate, you need to alternate between 1 minute each of hot and cold for 3 to 5 cycles. That's what they say. So this is basically, in my opinion, yeah, in my strongest opinion, has really profound effect on your health. It really boosts your immune system. So this is something where a lot of people nowadays, what has happened is people are starting to neglect in their day-to-day running around, that they are neglecting the simple thing of their showers. Also, they just want to just quickly shower up, get ready, and leave for work. But you need to understand that everything starts in the morning itself. If you do everything right in the morning, your whole day goes right. So the shower is something where people have not, taken it seriously also. So if you just this is a simple form of an exercise where you're playing with the hot and cold. You are really building it up. You need to understand the cold water constricts the blood vessels, and then the hot water helps to open it up. Okay, so when you're constricting the blood vessels, the blood will get to the middle of the body. It just constricts into the middle of the body. Then the hot water will open up the blood vessels, then opens it up. And it just opens up like it's just again out. In and out, in, out. That is how it works simply. So when you have a cold water, your blood will just constrict right in the center of the body. And then after that, it will just open up with the hot water. So this can pump the blood completely through the muscles and organs, and it is great for regeneration, detoxification, and also makes the body stronger and less prone to common colds and virals. So we don't really need the vitamin C or anything as such. Now in this current scenario, yes, we do. But if you do the simple thing on a regular basis, you are actually building up your immune system from within.
Okay.
So this is how I would see, and I would like to conclude today's session. And I would like to leave the floor open now for any more further questions.
So you suggest that we should have hot and cold, two or
Yes,
three cycles?
every day. Yes. 3 to 5 cycles of 1 minute of each of hot and cold. But when you talk about hot and when you talk about cold, it has to be really cold.
Okay. Well, that's why we don't get nowadays
Exactly.
monsoon or some winter season or something. But Bombay is, cold is no cold.
Yes, exactly. So you just stick to whatever is there, whatever when you just open up the tap, but don't go with the hot water then.
Okay. That would be. Even the
And
dry skin, you have to use cream every time after moisturizing cream, because the dryness increases, which I noticed after the hot water. As you rightly
yes,
said, that all these things happen. The dryness happens a lot.
exactly. Like I said, the keratin cells around the epidermis layer of our skin, that is affected, and then it kind of releases a certain chemical which makes the skin very itchy after that. So we need
Okay.
to be very careful with it.
Right. Good information, Sunil. I really like the session, because I'm prone to injury quite very often, and then I have to take more care by doing certain exercise, and then I get a little worried. Should I do an exercise or not? Should I do this or not? Or should I do that or not? Or that is injuring me, or this is injuring me. That confusion always remains in my head, and always confused.
No. This is a simple thing that we need to practice at home. And a lot of people don't, unfortunately, share these, and we are left in the dark, and many a times, and we are dependent on medications for such kind of thing,
Very,
but we don't really need the medication for all this. So all this can be
You know,
handled the natural way.
very much. That's good. A good session. We enjoyed the
Thank
session.
you.
I like the.
Thank you.
Sorry, couple of questions.
Yes, Arash.
Yeah, so we spoke about the icing, right? And
Yes.
in case there is a tear on a muscle, tear on a skin. So imagine if the skin is wide open, but obviously there's a swollen. Can we still apply ice or not?
Yes, you need to, because when your skin is torn, that means it is going to be bleeding profusely. And icing will kind of, like I said, it constricts the blood flow around that area. So you need to, for anything, if you have a cut and you need to stop your blood flow from there and you need to stop the bleeding, ice is the best thing.
Okay, okay, thank you.
So ice
And
is the best thing.
now, most of the gyms, especially in India, are equipped with only steam sauna, not even dry sauna, which my favorite is dry sauna, of course, but there is not here. So steam sauna. So we know that the temperature is hot over there, so it works like hot shower. And
Yes.
I've seen many of clients, many of members, they are taking the sauna so seriously that they just come to gym because of the sauna. They just
Yes.
exercise because of the sauna. So we keep telling them that it's not advisable to do it every day, but some of them, they don't listen. So what's your point and what's the right way of using it? When? Is there any age limit and some knowledge?
Yes, see, sauna and steam, okay, and also when I talk about that, I will also include the jacuzzi also, right? These are the things where people who have a cardiovascular, especially they have a weak heart, it is not really good for them to use more than 10 to 15 minutes at the most. Because then that's what happens is when you are in these places, you are in a certain amount where the blood is pumping, are going to be going to be pumped a lot, and that's when the heart takes a toll, right? So for a person who has a heart issue, right, and a person who is above a certain age of like say around 60 plus or something, not more than 10 to 15 minutes for them. One.
How about
And
every
for
day?
yes, exactly. And another thing is in jacuzzi also, where you see a lot of these people going into the jacuzzi and they're just sitting there for hours, but they don't really realize the kind of impact it's having on the heart itself. So jacuzzi itself also, it's always, you remember, jacuzzi is hitting your body. It's hitting your body, and whenever that pressure hits your body, it kind of creates, like I said, it's a shock to the body. That shock sends a wave to the your heart, and then the heart, in that response, it pumps out more blood. So we need to understand that's when it has to work to a certain limit, and when we overdo it, we are really asking for trouble. And for younger generation, like I said, like I already mentioned with the hot shower, the same thing with the sauna and the steam. If they go beyond, say, around 20 minutes max, for the younger people, then they are going to have these itchy problems and all that stuff. So that's when that's what they say. Post your steam or sauna, you need to hit a chill shower.
Yes.
So,
it is not that to close the pores,
that-
but to kill all the enzymes around it.
Thank you.
Sunil,
Yes.
when you have high blood pressure, is it okay to have sauna or steam?
It is not. For a high blood pressure, I won't recommend sauna, but steam, yes, 10 minutes.
Okay. But how high? Because when I was going to my physiotherapist and when I talked to some people, I think 150, 100 or 140, 90 is the latest WTO or WHO suggestion that 140, 90 is no high blood pressure. And when I have 140, 90 in the morning, I'm worried it's too high because I was always used to my blood pressure used to be always 115 to 75 or 80. And that the tension of this pressure is bringing
Exactly.
the high blood pressure higher.
Exactly. That's why you don't, I'm just telling you, don't look at the numbers. Don't look at the numbers. Don't look at the weighing scale. Don't look at all these ranges around. You just need to see and feel how you're feeling that day.
Okay.
You get up with that. You do that. You need to feel yourself. When you feel yourself, then you'll understand. That heaviness also which you have, then that is your body is giving a signal. Yes, I have a certain high BP that when I need to work it out. So that's a signal to you, but no need to go along and keep measuring yourself. Just calm
Uh,
it down.
One of my, who's a good friend of ours, cardiologist, like, throw away your BP machine from your house. This has become a mega problem for everybody, number one.
Exactly.
Number two, what happened is, being a hypothyroid, lately my doctor started giving me additional supplement of T3. Now, when I went to another senior doctor, who's an endocrinologist, who's very good in thyroid, he said, I never suggest T3 because T3 is one additional supplement which always brings your BP higher, or it always gives you more palpitation. Now, to going back to the regular doctor and saying, no, I don't want to take this, it's like, whom to listen and whom not to listen to, number one.
Nowadays, see, nowadays it's a really a game of it's a hearsay basically. It's your word versus my word with the doctors. Believe me. And right now, I don't know why is he giving you for the T3 now. Have you done your T3 and your T4? What is your levels are with your T3 and your T4 levels? You need to first
I'll tell
check
you.
that out.
It's
You
been
need to
always
first
under
check that out. So why do
it's
you
been always
need
control.
T3 boosters?
In 2018, somewhere at the end of 2018, he said start taking his supplement, and after that, my consumption of thyroid now 150 came down as low as 750 also. Now, when I went to the senior guy, NF Shah, who's in Hinduja Hospital, he said, Sunil, it happens like this, that most of your thyroid which you take, the T3 is, the THS converts into T3 to a great extent. But if you start taking supplement of T3, then your capacity of your gland to convert to T3 gets reduced. And that's where
Naturally,
your consumption of thyroid goes down.
that's
So don't
true.
do that.
That is true because you are actually killing your natural instincts. Your body immune system, which is there to build up the thing, you are actually killing it. You're making your immune system lazy. Let me put it that way. Your body is
In,
used to producing certain chemicals around it for it to keep a certain balance, right? When we are going to give it that additional thing, so your body is going to say, okay, fine, it's already has that additional supplement. I don't need to produce it more, so fine, I'm not going to do any work.
so NF Shah says don't consume T3. Now this guy was my regular doctor, who's also a thyroid expert. He said, no, take this. Now I get a little confused on that. So now yesterday when I tested my thyroid, it's all in normal condition as per the report. I know with this higher consumption, maybe again I'll tell you, I'll take little time of yours, a little extra time. I had thyroid when I was 32-year-old, hypothyroid, when 1992. Till 2015, there's been a continuous control, like proper with 150 mcgm. If I change anything, it will go haywire. 2015 or 16, it started fluctuating a lot. Now, he says maybe aging, or sometimes it so happens that it keeps on changing for some reason. He reduces the dose, the TSH goes up very high. He increases the dose, the TSH goes very, very low, below 0.5. My cardiologist would say you should always maintain between 2, because you're now 50 plus or 55 plus, maintain between 2 to 3. This sort of thing, because now everything, doctors are so commercialized. Now, when we listen to your session and all, we get little boosted up. Yes, this is fact. A lot of other things
But
when
you
you
need to
listen to.
understand, see, that time which you had when you already had the fluctuation of 2015 onwards, right? Now, basically is you need to understand there is not only that with your age, but also maybe at that point of time you were going through a lot of stress factors also, because stress is something which also leads to this.
Yes, stress,
So you need
possibly
to
the BP.
understand. So these are all the things where you need to understand. So at the end of the day, you don't really need to rely on medication.
Yes,
Yes.
you're right.
Yes, Saroj.
I have two questions.
Yes.
Just to go back to the sauna and jacuzzi. Here in Europe, we always have little signs in front of the sauna cubicles saying don't stay longer than 12 minutes. Okay, just to give you some kind of guideline.
Yes.
Second, when we're talking about Mr. Goenka's blood pressure, now the new thing or the new trend here is do a meditation. What is your view on that?
Do on medication.
Meditation to bring your blood pressure level down.
No, see, that
Meditation.
is where, yeah, meditation you're talking of.
A trance meditation,
Oh,
TM.
oh, meditation. Okay, okay, meditation. Yes, yes. See, meditation works not only for your blood pressure. It works on a lot of things. See, first of all, we need to understand any problem that starts right now. What we have starts from here, the stress.
Okay.
Okay, that's the primary factor. Otherwise, before the stress factor was anything that we ate. We ate anything wrong, then that's where the cause and effect was around the body that we were having a problem with. So if you can, when you're doing meditation, where you can learn to control your mind, it's the mind over matter. That's what we talk of, right? So meditation can help you control a lot of things around your body system. So even if you're a diabetic, whether you be blood pressure, I have seen people, even with cancer, who are going through chemotherapy, right? And when you talk about chemotherapy, those 6-7 sessions that they go through is like a hell for them. Believe me, when they have the chemotherapy sessions, it's hell for them. And some people I have seen who have such a strong mind that when they are done with the chemotherapy, they're still happy. They're still boosted up. They don't feel anything about it.
Because they control with their mind.
Exactly. It's a meditation. That's what they do. It's a mind over matter.
Sure, sure.
So meditation, yes, but that to attain that kind of the form, when we talk about meditation, one thing that always comes in mind is self-realization. We need to understand ourselves. If we can come to an understanding with ourselves, we can come to an acceptance of ourselves, who we are, what we are, and where we come from, right? That is the first battle you've already won. Then the second battle is how you control yourself. It is the attitude and how you look at things. How you attune yourself to an environment around you. How do you react? Anything and everything has its pros and cons. What do you really lay stress on, whether the pros or whether the cons? I have friends whom we talk about business, we talk about new ventures, we talk about anything. The first thing they will say, okay, they start with the cons. Okay, we're going to have this problem, we're going to have this problem, we're going to have this problem. But I say, no, okay, let's talk about the positives first. We can venture out in this, we can do this, we can achieve this goal, we can attain that. That is how the approach has to be.
Yeah, okay. And I thought you would also cover pain management on this session, but perhaps maybe next time.
Yes. Now, pain management, again, it is the reason why I did not cover pain management is, again, it's very difficult to really pinpoint on the pain itself to talk about. Pain can be in a very different form. Okay. And something which we really cannot really, it's a very medical, this thing, and something where we cannot really pinpoint on what exactly is the pain. So if I will talking generic on a pain management, it will not be right. So if I have pain around below my rib cage, yeah, I can very simply construe right in the center of my rib cage. It can be gas. I have pain there, but then it can be something else also.
Right, right.
So
okay,
we don't know. Yes. So that is something where we need to be very specific. What exactly is the pain? One, why did the pain start? Did we eat something wrong? Did we do something wrong? Did we lift something wrong? Or is it something which has been genetically inherited? So this is something which we need to understand.
Sure, sure. Okay, accepted.
Yes?
Yeah.
Okay.
Thank
Any
you.
further questions?
Thank you.
Well, thank you so much for everything. Just one last question. I noticed some of my clients are like above 50 and they have neck pain in most of the exercise. Now I notice when they do crunches, especially crunches, they overuse the neck, which obviously put a strain on the neck. So I fixed that posture. but still I feel like they are really worried about their neck compared with any other body part. And obviously, being a wrestler, we do lots of neck exercises.
Yes, yes.
So I started adding some of those to just give them, without a weight, obviously, just their regular exercise, just to maybe strengthen the neck muscles. And do you think it's the right approach or not?
It is. It is. It is a very right approach, and it's good you brought it up, Arash, because just around a year back when I was in the gym training, yeah, and I saw one lady. She was in her 60s, yeah, and she was doing certain exercises for her neck strengthening with weight, and I had to really go and stop her from doing what she was doing because she was she thought that she was strengthening her neck muscles, but then she was actually damaging it further. And when I asked her what was the problem, who told her and what was the thing, she said she had some neck spasms and she had a stiffness around her neck. So the trainer out there had given her some weights to do, and that's what she was doing with that. I had to literally stop her. Then I gave her 3 sets of exercises to strengthen her neck. And like you would be knowing is basically you can use a hand strength, you know, from front or hands from the side.
Sideways.
These are the best to strengthen your neck muscles. And what you are saying is absolutely right, not only for people who are in their 50s, but also even earlier. They need to have this neck muscle around very strong. Because see, this is very important now. When I'll give you a very simple example. A few years back, I was driving, and thanks to my training and all that stuff, and every day I do my neck muscle. So I was driving and I had a car accident. And then when you do a car accident, right, your neck tends to whiplash, right? You tend to have a whiplash. Why you have a whiplash is basically is your neck muscles are very weak and your head just jolts up. But fortunately, my muscle was strong, so I could just take it that way. So I prevented a whiplash.
Right. So
this is something very important, and you already in MMA when you're doing, or in boxing when you're doing, or in mixed martial arts, or any martial arts, the first thing that they do is they build up the neck muscle.
True.
It's very important.
After my free and neck exercise, I do this, resistance. So that gives, that has really a little strength.
So there are 3 simple exercises. One is basically you put your hand behind and you lift it up. You lift it up with the resistance, right? Then second is you put your hand in front and then you push it down and you resist it. You push it down and you resist it. And second is this, you resist it. You're resisting it. Same, you resist it.
It really helped a lot.
Yes. So these 3 simple exercises are required where you can do, and sitting anywhere, you can just do it at any given point of time.
Correct.
Apart from that, you're talking of your neck rotations are there, your side movements are there. So these are kind of to loosen up the muscle. But for strengthening, these 3 simple exercises can be done at any given point of time, at any given point of the day.
Okay.
Okay. Thank you for that.
Okay.
Thank you, Sunil.
Okay. So,
when do we have,
sorry?
When do we have a next
next session? I'm going to now, like I had, we had decided last week, we'll have a next session where we're going to have some kind of making protein shakes and all that stuff. So we are going to plan that out now with Arash, and Arash is going to be our one who's going to be making some shakes. So let me just plan that out with him. And then this is something where we can do at home, have some nice natural protein shakes at home.
That's good.
Rather than going for the artificial ones. Yeah?
Lovely. Lovely.
Okay then.
Fantastic.
Hey, thank you everybody.
Good. Thank you very much.
Thank you.
Bye-bye. Have a nice Sunday. Bye-bye.
Thank you. You too. Bye-bye.